which involved me participating on a daily basis to give readings via my mobile phone on various aspects of my condition. Now, the object of this was it can build up a pattern, and also gave me emergency medication that I took at home on the instructions on whatever my condition was, on the results that came through for my condition. So the process worked that I was given a chart with sputum colourings on it that I could identify. I would take a sputum reading every morning. I'd also have a thermometer, which I could take my temperature, and also an oxygen meter, which I would take my oxygen readings every morning. And also I had a scale, which I could also take my weight, not every day, but sort of a couple of times a week to see if there was a variation, either weight dropping or gaining. And these readings would be sent through via a text message in the morning. Now, my programme was around about 11 o'clock in the morning, and my first message would be, what are your sputum readings this morning? And of course I would send back either 1, 2, 3 or 4, and then it would come through, what is your oxygen readings for the morning? And again I would put through what my oxygen readings were, and based on those two, whether it progressed onto something else. If my readings were low or my oxygen levels were low, I would be told, given a message either to contact the surgery or to take my temperature. What is your temperature? And if my temperature was high, it would say possibly start your emergency rescue medication, which would be antibiotics and steroids. So in other words, it identified that the illness was starting. I probably hadn't realised it, but there's an exacerbation starting. So to stop it before it actually takes hold of me. And as a result of being on that pilot, I think, well, I was in regular contact with my my practitioner, and we I used to come just for my annual airways disease tests, and we were able to manage my condition at home rather than me having to come backwards and forwards to the surgery, which again would be difficult because I've got to get out of the car, walk to the surgery, sit in the surgery full of people that are ill, and I'm coughing and spluttering as well, and keeping me out of a situation and enabling me to stay in my own home and manage my condition. And as a result of it, I haven't had to see a doctor about my condition for 2 years.
When they took Florence on board, a lot of people were initially delighted because in their words, it felt like it was helping them, someone at home. They didn't have to come to the doctor's surgery, didn't have to look for a doctor to get antibiotics, because we would provide the plan, we gave them the equipment, and we gave them the antibiotics and steroids to treat themselves at home. So with the help of Flo, what's happened at the surgery, we found over the period of 2.5 years, most, I would say probably 9 out of 10 of our patients who've been on Flo hardly ever come to the doctor's surgery now. They treat themselves at home. They're very, very astute now of when they know they have a chest infection. They actually know when it's coming on. Flo then determines whether they need to take the rescue medication, so they're treated early, very rarely come to the surgery. And from my point of view, once a week I'll have a look at the records that they're texting into Flo. If I find there's an alert which is unusual for that patient, I can then ring them up and ask them to come in and discuss why that alert has happened. It could be a fault in the equipment, it could just be an off day. So it depends on what the patient would say to me. However, it's very easy from a nurse's point of view. It takes approximately 3 to 5 minutes to set the person up on Flo. It takes another 5 minutes to discuss the equipment and the management plan, and really it takes sort of 1 or 2 minutes a week just to oversee what's going on. We always advise, if they have used the rescue medication, just to let me know how they've got on, and if it was successful, we would then give them another prescription so they've always got their own treatment at home. We've found at the surgery it's reduced the doctor's visits by around about 75% in patients who are on flow. We use it for lots of things, not just COPD. However, COPD has given us sort of the marker, if you like, to use it in other areas of health. And I would say probably 85 to 90% of patients who are on flow can see a benefit in their own health, self-monitoring. And from my point of view, it's very, very easy, and it's peace of mind for me as well, because I know my patients are safe.